My name is Jason Chandler. I do malignant hematology, so I'm a cancer doctor, but I mainly deal with blood cancers. And I like to take care of different types, but the main one I focus on is multiple myeloma. So I'm excited to introduce you guys to Jered, and he'll tell a story about his path from diagnosis to getting into remission, and then how he's moving on and really performing at a high level after being diagnosed with multiple myeloma.
I was diagnosed with a rare form of bone cancer called multiple myeloma. Now, before my diagnosis, I had never heard of multiple myeloma, and up to that point, I was active. I was riding my mountain bike, outdoors, doing all the things. I just finished a mountain bike race here locally, and when I got done, the pain was so intolerable that I went to go see an orthopedic doctor. At that point, and I was not sure what it was. The first symptom felt like an itch on my tailbone, and it progressively got worse, where it became soreness in my back, and then ultimately it led to the lightning bolts that shoot down your leg, almost like you have a bulging disc.
For multiple myeloma, it's their immune system that's gone haywire, and one little part of their immune system. So when that starts happening, it can kind of expand and grow, and I usually say it's like a cancer of the blood and the bone, because it can make holes in your bones, which can cause pain. It can make you anemic, make your blood low.
I literally sat on my symptoms for about 5 or 6 months. I was very stubborn with it, and when I finally decided to go in to see a doctor, that's where they ran an x-ray on me and determined that there was a mass on my spine. When the doctor walked back in the room, he said, "Mr. Haddad, how are you feeling?" At that point, I was taken aback, and I obviously was there for a reason, and I said, "Something's up." I said, "I feel okay, but what do you see?" That's where the doctor told me that something had metastasized in my spine, and he wasn't qualified to give me a diagnosis. And it was at that point that they referred me over to Dr. Chandler at West Clinic.
Unfortunately, it's an incurable cancer, but over the last several years, we have so many more treatments available for it. And so we're able to treat people and get it to disappear or go into remission. And now those remissions, those times that it's asleep, where the patient's living a normal life, are getting longer and longer, and we have more and more options where patients are living 10 years, 15, and I have patients in my practice that have over 20 years that they've had the diagnosis and have a really good quality of life.
So after seeing Dr. Chandler, then I went through a series of common tests, blood work, and ultimately a bone marrow biopsy, which confirmed the positive diagnosis for myeloma. For me personally, it wasn't scary. I lost my dad to cancer, and through his battle, I believe that I had some knowledge of what I needed to do myself, and for me, that was the trigger to start the fight. And there was no doubt about it what my intentions were. It just then became a matter of learning the disease and understanding what my treatment options were. Fortunately for me, I had several resources, people that were close to the myeloma community that led me down the path of what the standard of care is for myeloma. And then once Dr. Chandler had given me the options for treatment, then it seemed clear as day to do those. So once I got the disease under control with West Cancer Clinic, I was able to then focus on the higher level of treatment, which is what they offered me at Mayo Clinic up in Minnesota.
Right now, whenever a patient's diagnosed with multiple myeloma, they're given multiple medicines, and then usually they get an autologous stem cell transplant where they get a really strong dose of chemotherapy and they get their own stem cells back to rescue them. And then we came up with this new treatment that just got FDA approved in the last couple of years called CAR T. But what they do is they take part of your own immune cells out, your T cells, out of your blood. They just draw them out, and then they engineer them to fight the cancer, to fight the multiple myeloma. So they insert little instructions to tell your own immune system to go fight the cancer and to not give up until it's all gone. And then they give them back to you, and they grow in your body, and they fight the cancer, and oftentimes make it disappear where we don't see it at all.
In my case, they collected about 12,000 T cells, and they sent those off to a laboratory where they genetically modified them into 7 million supercells. those T cells were put back into my body, and it was designed to attack the cancer. And within 45 days it worked, and I was in complete remission.
And so Jered wanted to be as aggressive as possible, so we got him up to Mayo Clinic where they're doing a clinical trial. So he got his treatment and got CAR T in the beginning. We hope that that'll be the new standard in the coming years, and then maybe everyone will get that. And maybe someday, not yet, but maybe someday we'll have a certain combination where we can actually cure it.
I was doing so well. I was really surprised with how my body handled it. And what Dr. Chandler and what the other doctors had told me is that my health and my age would play a factor as to how well I tolerated this. And in my case, I reached the gold standard of treatment and response. It's called MRD negative. And fortunately, I have remained MRD negative since about 45 days after my CAR T. The Iceland project started in 2016. That's where they launched genetic testing and blood testing of the population. And it was at that point that they were surprised with the results. The amount of people that had showed symptoms of myeloma, that showed precursors to myeloma, caused them to launch this expedition.
The IMF is very in the forefront for research for multiple myeloma, and they support investigators, people that are trying to figure out the next best thing. And so they like to raise money to help all the doctors and all the scientists and everyone come up with cures. And so it's really exciting that Jered's able to participate after going through all this and participating in a trial and being in remission, and then being able to go to Iceland and bike at a high level and do this after he's been through all the treatments he has. It's really amazing.
I qualified for this expedition because of my personal battle with myeloma. And as a result of the treatments I went through and the success of the treatments, I think I got a story to tell. And that's given me the chance to participate with these 11 other cyclists. And we're going to be going across and telling our stories individually, hopefully to spread awareness about this disease, raise money for it, and ultimately find a cure.